Sylvia groans with frustration and pain, wishing she could join her family on their canoe trip. Instead, she's recovering from a broken wrist. Sylvia can't even console herself with a cool injury story. Her wrist didn't break during an exciting adventure. She just tripped over the kitchen rug. Now, her healthcare professionals say she has osteoporosis, a disease of weakened bones. She's only 53 and at risk for more fractures. Between worrying about her children, her aging parents, her history of breast cancer, Sylvia never even considered her bone health. Doesn't osteoporosis only affect the elderly? And Caucasians? How did this happen? Could it have been avoided? When it comes to bone health, the question isn't whether you're at risk of breaking a bone, but rather how much risk. Weak bones aren't limited by ethnicity, sex, or even age. 1 in 2 women and 1 in 4 men will get osteoporosis and are therefore at much greater risk of breaking bones repeatedly and suffering loss of independence. Called the silent disease, you may not know you have osteoporosis until you break a bone. As a Hispanic woman in her early 50s, Sylvia assumed she wouldn't be affected. But if she'd considered what might weaken her bones, she'd have realized how high her risk actually was. She could have strengthened her bones to avoid her broken wrist, and she can still lower her risk of future breaks. It's never too early to start strengthening your bones. The loss of bone leading to breaks happens over a lifetime. Your bone gets stronger during childhood and adolescence, reaching peak bone mass by your early 20s. As you age, your bones start becoming weaker. Your healthcare professional can explain ways to slow this process and strengthen your bones at any age. Many people don't reach and keep peak bone mass because of foods they avoid, lack of exercise, other health conditions, or medications. They're more likely to develop weak bones, even at a young age. As a teenager, Sylvia worried about her weight and often drank coffee instead of milk. She preferred French fries over broccoli. Sylvia didn't realize what she ate had such an impact, but a few changes to her diet could have made her bones stronger. Calcium is key to building strong bones, and vitamin D helps our bodies absorb calcium. Sylvia and her husband now plan family meals with this in mind. Her osteoporosis indicates their children have a higher risk of developing the disease. Growing strong bones and forming healthy habits now helps lower their risk. Building a career and caring for a family is exhausting. Most evenings after the kids were in bed, Sylvia collapsed in front of the TV, sometimes consuming 3 to 4 alcoholic drinks in an evening. If she could go back, she'd limit her drinking to 1 glass and go for a walk instead of zoning out on the couch. Bones become stronger when used. Sylvia wasn't interested in sports, but weight-bearing exercise like walking helps keep bones healthy and strong. Smoking and excessive alcohol consumption can damage bone cells, increasing the risk of weakened bones. Sylvia's dad, George, fell and broke his hip last year, and Sylvia worries he'll never be able to get back to all the activities he enjoyed. George blamed his broken hip on the icy front step. As Sylvia learns more about why bones break, she realizes weak bones were really the underlying culprit. Once his hip healed, George insisted he felt fine and stopped taking his medication. But just because his fracture healed doesn't mean his bones are in better condition. Sylvia urges George to talk to his doctor about restarting his medication and learn a few simple exercises to improve his balance and lower his risk of another fall. It took a broken bone to teach Sylvia the importance of thinking about bone health. Making a few simple lifestyle changes might have spared her the expense, pain, days off work, and limitations she's experiencing now. Not to mention, those same lifestyle changes would also improve her health in other areas. But Sylvia's story isn't over. Her healthcare professionals obtained a test to assess her bone density and determine her risk of more fractures. She's working with them to reduce her risk through medication, diet, fall prevention, and regular exercise. What is your risk for breaking a bone? What steps can you take to make your bones stronger? This video is brought to you by the United States Bone and Joint Initiative. Our Fit to a T programs provide opportunities to meet with healthcare professionals to learn about assessing and reducing your risk of weakened bones, as well as the latest advances in knowledge about this disease. Visit fit2t.org to learn more and organize a Fit to a T session in your community.